Hi, my name is Daryl, and I'm Director of Professional Services here at At Home Medical. This is Kim, one of our respiratory therapists. Today, we will be reviewing your oxygen concentrator and the appropriate equipment that comes along with it. Remember that oxygen is a drug and can only be prescribed by your physician. You have received an oxygen concentrator from At Home Medical. Please know that this may not be the exact concentrator that you have received, but they all work the same way. The oxygen concentrator works by taking air out of the atmosphere and separating the oxygen from the nitrogen. It then filters out the nitrogen and leaves oxygen in your concentrator. That oxygen is delivered through your machine and into a nasal cannula. Your physician has prescribed the liter flow that's needed in order to maintain the appropriate oxygen saturation levels. Again, please remember that oxygen is a drug, and you may not, without a physician's order, change your liter flow. You have been given a nasal cannula. The nasal cannula is an accessory that delivers low flow amounts of oxygen. In order to receive the adequate amount of oxygen, it's important that you use your oxygen equipment properly. When inserting the nasal cannula into your nose, it's important that you place the oxygen cannula in your nose the right way. The curvature of the cannula should follow the curvature of your nose. Place in your nose and wrap the tubing over your ears. Remember to have the nasal cannula on nice and snug so that it doesn't fall out while walking or sleeping. Remember that the end of the nasal cannula should be placed nice and snug in the port on the oxygen concentrator. Make sure that the machine is in the on position. There's a little ball in the liter flow that will tell you exactly how much oxygen you are receiving. You will also receive different lengths of tubing for extra mobility. You will receive 50 feet of oxygen tubing and 21 feet of oxygen tubing as well. Please remember to appropriately attach the oxygen tubing with the little oxygen connectors that you will receive. I will now have Kim demonstrate to you the proper cleaning techniques as well as troubleshooting tips.
Now let's review some cleaning procedures and troubleshooting tips. Every 2 weeks, you're going to change your nasal cannula. Every day as needed, you can wash it with a warm cloth. If you are using 21 or 50 feet of tubing, you will replace it every 1 to 3 months. If you are experiencing trouble with drying or nosebleeds, you can add a humidifier to your concentrator. You will remove the tubing from the concentrator and replace it with the tubing from the humidifier. The other end that you've taken off the concentrator will now go onto the port of the humidifier bottle. You are going to clean the humidifier bottle with warm soapy water every day. Rinse it out. You can also disinfect with your 3 parts water to 1 part vinegar and replace it with new distilled water every day. The humidifier bottle gets placed in a holder on the back of the machine. Some troubleshooting techniques. When using a humidifier bottle, we need to remember that we need to thread the top on properly as well as the port that goes to the tubing to the concentrator. Make sure when taking the bottle off to replace your water or cleaning, you make it go flush on top and turn. Sometimes this causes problems because you do not have it threaded properly, and therefore you will not get your bubbling from your humidifier bottle. Also, with the top of the humidifier that goes to the concentrator from the tubing, you have to make sure that this is also threaded on properly. If this is all properly threaded on, you will get bubbling in your humidifier bottle through your water. If there is a light and an alarm coming from your concentrator, you will go to your backup tank. Then you will troubleshoot your concentrator. Always please check that your plug is plugged into the wall and also that your electricity is on.
Thanks, Kim. One of the important things to remember when using your oxygen concentrator is that the tubing is always secure underneath either a carpet or taped onto the floor. The tubing can very easily be a tripping hazard, and we will work with you to make sure that you use your oxygen equipment safely. Again, if you have any other questions or concerns, you may speak with one of our respiratory therapists by calling At Home Medical at 1-800-287-0643. As always, if you have questions regarding the amount of oxygen that you are on or any other specific medical questions, please contact your physician directly. Thank you again for choosing At Home Medical, and remember, miracles happen at home.